The evaluation criteria for the AP knee projection consist of evidence of proper collimation, also the knee fully extended if patient's condition permits. So making sure that our knee is fully extended from top to bottom, from the femur down to the tib fib. Also the entire knee without rotation. So here you can see we have our knee. And the open femoral tibial joint space with inner spaces of equal width on both sides if the knee is normal. So here you could see the open femoral tibial joint there. And also soft tissue and bony trabecular detail. So checking for soft tissue and bony trabecular detail. See our soft tissue on the sides and then our detailed bony trabecular here on the image. For the second projection, which is the AP oblique knee with medial rotation, we first want to check as well for evidence of proper collimation in the image. Also, the tibia and fibula separated at their proximal articulation. So we could see here we have our fibula and tibia and they're separated. As well as the lateral condyles of the femur and tibia. So here we could see the lateral femoral condyle, and on this side we have our medial femoral condyle. Down here below we have our lateral tibial condyle, and then our medial tibial condyle. Also both tibial plateaus, which is the flat surface of the tibia, could see it, as well as the margin of the patella projecting slightly beyond the medial side of the femoral condyle, which could be seen here. It could be seen here, our patella is slightly on the medial side. The third projection, which was the lateral projection of the knee, the evaluation criteria consists of evidence of proper collimation, also us checking that we actually flex the knee properly, which was 20 to 30 degrees. And we could check that by demonstrating the femoral condyle superimpose. So here we could see the femoral condyle superimpose. And then also the fibular head and the tibia slightly superimposed, which is down here. As well, another thing that we need to look for is the patella in a lateral profile, which we could see our patella over here. And the open patellofemoral joint space, which is here. As well as our open joint space between the femoral condyles and tibia, which is down here below. And finally, just making sure that there is soft tissue and bony trabecular detail. So we could see our soft tissue on the sides and our bony trabecular within the image. The evaluation criteria for the fourth projection that was done of the AP axial projection of the intercondylar fossa, which was the Beclair method, consists of open intercondylar fossa, which we could see here. Also, the surface of the femoral condyles, which here we have our lateral femoral condyle. Over here we have our medial femoral condyle, as well as the intercondylar eminence and knee joint space. So intercondylar eminence is here, and we have our joint spacing here, the opening of it. And finally, no superimposition of the fossa by the apex of the patella, so there's no superimposition based on the fossa and by the apex of the patella. Your patella is like up here. Fossa is down here. And no rotation as demonstrated by the slight tibiofibular overlap. Here we have our tibiofibular overlap. And finally, just checking for soft tissue and bony trabecular detail, and that could be seen within the image. Now for the last projection of the knee that was done, which was the tangential projection of the patella, and the method that was done was the Setagast method. For the image, we have to look for evidence of proper collimation, also the patella in profile, which could be seen here. Also the femoral condyles, which here we have our lateral femoral condyle, and on this side we have our medial femoral condyle. And most important, checking for the open patellofemoral articulation, which could be seen here within the image. And finally, just soft tissue and bony trabecular detail, and that could be seen within the image in general. And that concludes the evaluation criteria for the 5 projections that were done of the knee.